Hello, how are you? All right, breaking news, right? Real quick, okay? We just want to come back and just highlight this particular letter. This letter came from CMS, Centers for Medicare, Medicaid, Pamela Parr. All right, she's a nurse there. Um, the actual letterhead itself, or whatever, I've already illustrated that on Twitter for you. All right, so you can go out on Twitter. Check it out. Twitter is where we try to bring the awareness, all right, to the people, okay, all right, who obviously don't have the true awareness of what's really going on out here, all right, in the universe, okay. But we're going to make sure that you have that awareness because it's necessary, okay, because most of you guys are the ones that are affected by the poor behaviors, all right, and these particular actions and things like that of entities and people such as River Vista Behavioral Health, which is was illustrated here in this particular letter. So this letter came post complaint to CMS about a patient that had actually been inpatient at this particular facility, River Vista Health and Wellness LLC in Columbus, Ohio. And they experienced themselves abuse. Okay. So what River Vista was in there doing was putting the person in restraints, and having staff attack that person, enforce medication, and even in situations where the person was no longer a threat to himself or others. Okay. Um, then that particular patient, when they got out, came and told a story of where while they were there, they actually witnessed a man, a big, bulky man, punch a woman in the face, in her eye socket, knocked her down to the ground. And the person who told the incident said, "Oh my God, it was horrible. She was effed up. She was fucked up," is what he said. And we said, "So what happened? I mean, did anybody come to the lady's aid? Because obviously it was a co-ed floor, all right? They were all on the same floor. Maybe females over here, males over here, I don't know. But those two got into an altercation. That man punched her in the face. And this particular person said, nobody really came to her aid. They just, someone came over and said, hey, get up and go to your room and stuff like that. Well, we don't do that in healthcare, all right? You're a healthcare worker and things like that. You know that immediate duty is to the patient, right? So that was an injured patient. First of all, you have to ensure safety at all times. All right. So, multiple players should have been on board, okay? Because that man obviously was out of control. That's violence. All right. Why this has not been talked about, I don't know. It's been swept under the rug, or maybe they thought nobody was ever going to let it be known or something like that. But we gave them a chance behind the scenes to do what they were supposed to do. We gave them a chance, like we do everybody. We give you a chance. We say, listen here, that ain't right. Get it together. Let me show you what you're supposed to do. Get your processes and procedures and stuff in place. Correct yourself. All right, let's take a look in the mirror. What the fuck we doing here? And reevaluate. Go back to the table. Some modifications are necessary. All right. Let me know what you're doing here and how you're gonna move forward. And then we'll touch base back and see how you're progressing. Then they don't want to do it. So, we said, well, we'll just fall back and we'll observe. We'll let them go ahead and tell on themselves. We already know in the back of our minds we're going to let everybody in the world and the universe know if they don't get their shit together. So we said, we give them a chance to get this shit together. People like this, wrongdoers and things like that, what they do is they keep on doing the dumb shit over and over and over again. They're so stupid. They keep putting everything in writing and they provide you with all the evidence that you need. It's in there, it'll be in their own words and all that shit. I mean, and all you got to do is just give them right back their own shit. Like, but motherfucker, did you say this? Did you do this? I mean, you wrote it, you said it, you did it, right? You confirmed and affirmed. And now you want to sit here and act like you don't know and understand? Get out of my fucking face, okay? I'm not the one to be played with. I'm gonna tell you right now, wrongdoing, your time is up. Okay, so like here, River Vista Health and Wellness LLC in Columbus, Ohio. They too had the chance. All right. It was already working with River Vista themselves, saying, hey, clinical director, clinical supervisor, doctor, what are you doing? Case manager or whoever you are, LISW, what are you doing? What are you doing? Hello. This person that's in there has an advocate. And gonna be on your ass. But then it's gonna say, hey, this ain't right, that ain't right. What's up with this? What's up with that? And da. And also I'll let you guys know too, just know that your loved ones going in these places, if it's been some type of a mental health crisis, unspecified psychosis, delirium, and things like that, they get on a 72-hour hold. They're gonna take them to the ER first. All right, understand this. That's what 72-hour hold entails. They're gonna come get them, take them to the ER. An assessment in the ER is going to be done. 9 times out of 10, 72-hour hold is going to be placed. Then they're going to transition them to inpatient, okay? After the 72-hour hold is up, the patient will have the right to determine they want to get out or stay there. But see, they really don't explain that to the patient, that they have the right for 72 hours to decide if they want to leave or stay, right? But the hospital, 9 times out of 10, is not a good idea for the patient to leave, to be perfectly honest with you. 9 times out of 10, it's not. But they're no longer a threat to themselves and others, usually at that 72-hour hold, all right? But your places like this, River Vista and, Ohio State Harding and whatever these psychiatric hospitals, they want to keep the person there as long as possible because it's a head in the bed, that's a lot of money. It's damn near $1,000 a day, right? And they want to keep on milking it. And they're going to milk it and milk it and milk it. Like, for instance, like on Medicare, I believe they have an inpatient stay up to like 30 days. They'll try any and everything that they possibly can to keep your loved one or you yourself in here up to that. Okay. And they'll be writing shit and documenting shit all in your records and stuff like that. That we're finding out some of it is really not even true. All right. So if this is not the appropriate medical necessity when you're thinking and switch your mindset to insurance, if this level of care, inpatient hospitalization, is not the appropriate medical necessity, you need to get that person out of there. Okay? It's driving up costs. This is why you people need to have the awareness of what's really going on behind the scenes. Okay. In fact, insurance companies have the awareness as well. All right. So some of these hospitals and things like that are driving up costs deliberately so that they can get that money. But truly, there isn't the need for that. It's not medically necessary, but they are smart, right? They're smart. They know how to write up the documentation and they know the words and they know all this type of jargon and shit that will, if anybody, a layperson who really doesn't know, is looking at it or whatever, they can say, oh, okay, yeah, that makes sense. That's why they need to be in there. And usually terms like threat to self, harm to others, and all this type of stuff, or XYZ type of medication, emergency med B52 had to be used on this particular patient because they'll make stories up and everything like that. People, you got to be wise. And it's not, okay, it's not cool at all. We are in healthcare and we're not going to allow it. All right, we're not going to allow it. We need to tell the truth. All right, it's about integrity. Okay. All right. Now, if it's warranted and it's needed, right, there's processes in place. If extended inpatient stays in psychiatric wards and things like that is necessary for somebody's a threat to themselves and others, then so be it. But you need to be able to substantiate it, and it needs to actually be true and accurate. All right. But you got a lot of bullshitters and liars and stuff like that because they know that the money is on the back end and stuff like that. But guess what? They're doing these bad things at the detriment of these patients. And that shit's gonna stop. I've been doing my own longitudinal study for a very long time. I've been observing for a very long time. Okay. So what you're beginning to see now on the Twitter platform is actually my results and my findings. Okay. And I'm still continuing to do a study. It's never going to end. It's a never ending study that's going to keep taking place because the wrongdoings and the bullshit keep taking place on a routine basis, like daily, as you can see. In every arena, it's not just healthcare, it's everywhere. Okay, it's a whole big ass study. All right, I've already been doing it for a very long time. I got a lot of examples too. You ain't seen shit yet, okay? I just keep telling you about the same examples right now currently because those powers that be that are actually in place, like different agencies and stuff like that, Health and Human Services, okay? All right, like our office hours are, Joseph Ronnie Broom, what I talked about, another mental health type of a place, that Southeast Mental Health, 16 West Long Street, Columbus, Ohio 43215, or Wendy Williams. I saw all the shit that they're up to. All right. Okay. You got all kinds of stuff. You got HIPAA and high tech types of violations going on, with the confidentiality and breaches and all this type of stuff. Disseminating people's PHI, which is personal health information, all this type of stuff to parties that are not supposed to have the information. That's key. Right? You're not to be giving that information. Nobody said you couldn't send some shit over the email to somebody. All right. Your patient can tell you that you can go ahead and send it to me in an email. You need to outline to them, listen, I'm going to tell you what the risks are involved if we do this through the email and whatever, so you don't hold us liable for it or whatever. The patient says it's okay for you to go back and forth with the email and you can put your health information in there, then okay. But I dare you, Wendy Williams, sit up here and send a whole email intended for someone else, and then you CC somebody without checking the extension. You CC a patient's full first and last name. Their diagnosis is in there. Okay. We know they have anxiety. We know who their case manager is. Okay. Who Marie, KK, or somebody like that. We know what her last couple of notes said. All right. We know the dates of them. We know that the person was termed at Genesis. All right. And all this type of stuff. And we know that the case manager said she tried to take her to the pantry, but the patient was resistant, which is probably a whole lie. All right. Let's go talk to the patient. Let's see if she was resistant. And the patient gonna be like, she never asked me that. She never said that she could take me to no pantry. She never said anything like that. Or it's like, no, I don't want to go to no pantry. They don't give you anything on any quality foods anyways. Everything's mildewed and loaded and wilted, expired, and cans is banged up, trying to give me botulism. I don't want that. All right. Just because I got a mental health issue going on, you treat me over here for anxiety, doesn't mean I don't have any good sense. Doesn't mean that you could just run all over me and revoke my rights. All right, and be and control me and think that you're the dictator, some authoritarian over my life, my care, any fucking thing that got to do with me. Okay. You just gonna tell me what I'm gonna do and revoke my rights and shit like that. That's not what it's about. And that's actually what is actually happening out here. And your time is up. This shit's gonna stop today. Okay. Let me get word of it. And I mean it. And anybody out there in the world that wants to give me any information, you want to give me any information, and you want me to get it out there for you, you need some type of intervention, you need me to intervene on some shit, oh, let me know. We get free consultation. Now, if you start getting into some complexity and things like that, where you really need a sister to get to it, then you're gonna have to maybe talk about some other things. But for the most part, we're here to ensure that we at least at very minimum for free get you the awareness that's necessary to hopefully spark the fuel and fire for change to occur. And oftentimes it does when you get somebody else on your team. Lots of times, especially from a LLC perspective, or you have somebody who's already in healthcare that can advocate for you and say, hey, listen, I'm the patient. The advocate, they gave me the permission to do XYZ. If you have to show some type of a proof, then that's where we give you a document so you have the right to act as your representative and that type of thing. But sometimes all it takes is a simple phone call just for somebody to say, hey, how you doing? Mm-hmm. I'm a nurse, and I'm the nurse advocate, case manager for XYZ. And I'm trying to follow up on the many calls that the patient has placed in your offices. And it appears it keeps going to voicemail, and you have an office manager or a nurse, XYZ here. And I'm not sure if they're just so busy that they're neglected to check their voicemail or what's going on. But these messages have been left on this date, that date, this date, that date, at this time, this time, this time, and nobody's called my patient back. So I don't really know what's up with that, but that's neither here nor there. Now we're at this point. So I'm here now to step in to figure out and find out why the hell haven't you gotten that prescription refilled? All right. Because when the patient was calling here, they had 5 pills left of their blood pressure medication. And as of today, now that I'm stepping in, I'm calling you, they don't have none. What's up with that? Excuse me? I'm gonna need you to get on the phone right now. Call Walgreens at 614-777-9311. Yes, and I ain't talking about Morris Day and the time, bitch. Get to it. You'll be surprised. You'll be surprised. I've had to do it several times for people. Really step in. So people out here talking about their patient advocates and all this shit. They printing off fucking papers and stuff like that. That Google shit. They done Googled you something that you could do your damn self. Or like I said before, and something else, you can actually call the library, like the Metropolitan Library, and ask the librarian, are they able to help you locate resources for XYZ? And they can print you out the shits, okay? Now I'm telling you, I deal with this in my regular life all the damn time. I've experienced it with my patients that I've had to advocate for and things like that in past. And just it's constant. And it's all the fucking time. It's all these different places. All right. I could write a whole book on just different types of scenarios and stuff like that, and give you different types of case studies and things like that you could work on your motherfucking self if you're a damn nursing student. All right. How would you approach this? Now here you go. Right now thing. I'm making a video, child. Here, you need to. Yeah. Oh, that's empty. Here. Thought you was taking a nap. Oh, that must be Diamond coming down. All right, so I'm back. Anyhow, let's get to it. Because I actually just came on. Hi. How you doing? Huh? Yeah, I did. I left and I grabbed me a coffee. Pastor left his football here. Yeah, his football. He was gonna play throw the football with y'all or something out back or something. I don't know. He left it. So he said he'd be back over before he go to college, but I want to message him and tell him because I could take his football by. Because somebody pulled his door. I'm doing me an educational session about the patient rights. Hey, so yeah, I did. Okay. You want to go somewhere? You need something? Because I just got me a coffee. I took pepper.
No,
yeah.
I heard something down the thing, and I was like, I can hear it when you came back on my side. Like, down that way, like switch.
Oh. No, I'm back, girl. Ain't no telling what's down there, you know. That's a bad accident site thing right there, too, anyway. Push that boo. I'm making a video educational session for people out here, my patients. Yeah. You want me to go get your coffee? We can go somewhere. I was going to try to wait a little bit closer to check the thing and I can hit the bank.
Okay, that's fine. I got it. See down here.
Okay. Sorry for the intermission. All right, we back. Let's get. Huh? Shut up. Oh, okay. It's only 10:42 right now. You gonna get something early like that?
No, I'm gonna wait. Y'all, you're not going on.
No, not yet. I'm thinking maybe about 11:30. My first go round that I leave, I won't be going to the Y.
Oh yeah.
I have to hit the bank.
Yeah, not that right.
Okay. Okay, I'm back. Anyhow, we talking about excuse me, thank you. The true objective of this video today. It doesn't matter about how I'm doing anything on this YouTube. I'm just bringing awareness, okay? I can talk about whatever I want to, when I want to talk about it and stuff like that. And I might be all over the place, and that's okay. That's okay. I'm not getting paid. All right, now. All right. Now, this was from CMS, Centers for Medicare and Medicaid. All right. A complaint was put in. I already went over that and about what occurred at this particular place. Huh? Because you keep saying like, Okay, so let's read this together. This is in response to your complaint concerning the care provided by River Vista Health and Wellness LLC in Columbus, Ohio. Based upon your specific allegations, an on-site investigation was conducted by the Ohio Department of Health on April 1, 2021. Let's stop right there. So there's been a lot of subsequent complaints specific to psychiatric hospitals submitted to Ohio Department of Health. All right, so they definitely have the awareness. They absolutely have the awareness of abuse that took place against a disabled, mentally vulnerable person on April 14th of 2022. at OSU Harding. Yeah, and all that was encompassing at the whole totality of the circumstances, which was very severe, and it was retaliation, it was all kinds of things. They have the awareness of that, but yet they sent a document stating that they don't have the jurisdiction to investigate. And as you can see here, that's a whole lie, right? So you damn sure had the jurisdiction to investigate this particular psychiatric inpatient hospital place, right? River Vista Health and Wellness. What changed? Why can't you go in? It doesn't matter. We need to know who is it that investigates abuse of patients and revocation of patient rights at these psychiatric hospitals or any facility, outpatient and otherwise, specific to mental health or anywhere and anything that involves vulnerable populations of people that keep getting abused. Who is the oversight? Who is it? Is it CMS? Is it Ohio Department of Health? Is it Health and Human Services? Is it the Adam Board of whatever county, like Adam Board of Franklin County? Is it MHA, which is Mental Health of Ohio? Is it the police? Is it the courts? Is it Disability Rights of Ohio? Who is it? Is it the Ohio Attorney General? Because what we're finding out is nobody knows shit, nobody does a damn thing when it comes specific to mental health population of people in these types of facilities like inpatient hospitals and or outpatient mental health facilities. There's no true oversight where everybody is passing the buck. Is it the Joint Commission? Because each and every one of those agencies and entities that I just mentioned has the awareness of all of this. Everybody has the awareness of River Vista Health and Wellness LLC and their wrongdoings. They have the awareness of Southeast Mental Health at 16 West Long Street, Columbus, Ohio, 43215, Wendy Williams and Dr. Abu Hassan. They have each and every one of those. They have the awareness. Yes, they do. They know the abuse is going on. They know patient rights are being violated. Okay. All right. So when you're talking about rights and the deprivation thereof, you're speaking of everything all inclusive of the liberty associated with that right, the human right, the civil right, okay, and the constitutional right as well, right? And so I thought that the civil rights of HHS was the go-to when your civil rights have been violated and things like that. But they pick and choose what we found out, what cases they want to investigate and things like that. And in some cases, they really don't investigate because it is the employee, not the overarching entity, like we stated. The employee is the lazy one that we're figuring out, right? Is the one that wants to sugarcoat, sweep things under the rug. They really don't want to put in the time, especially when the case is complex and you might have a lot of substantial evidence and things like that. I explained to you before here on Twitter and a lot of other platforms that there was an actual case of abuse. It was the April 14, 2022, abuse that occurred at Ohio State Harding. All right. And even there was an attorney, his name was like Harry Panel, she's an Ohio attorney, that actually did revoke the right of this particular patient, the one that was abused, revoked his right to appear in his very own court hearing that was at Twin Valley. Yeah, he revoked that right. He lied and he made it seem as if the person waived their right to appear. So there's tremendous amount of need for investigation into these different complaints and these people that are being mentioned. Okay, so is it the state level inspector general? Is it the federal level inspector general? Is it the FBI? I mean, did somebody got Jesus' phone number? I mean, who is it? Because it's going on. Abuse, neglect, deprivation of rights. It's a lot of criminal, okay? So there's criminal shit going on, shit that's illegal and unethical. It's being brought to the forefront and the attention of these different agencies that are really supposed to be in place as advocacy for particular patients, especially those in vulnerable populations, okay? And it's not happening. They're not doing shit. They got the awareness. It's all documented, all right? So, next up, we're just gonna pull it all out. We're gonna give you all the numbers. We're gonna say, hey, oh yeah, so Arthur Salazar and Joseph Rungro, didn't you most recently just investigate or half-ass investigate? We want to know what all you did. the report of discrimination against a particular disabled man in a vulnerable population of mental health that is being discriminated against, and it's deliberate, it's intentional, it's willful of these health providers that are constantly letting spew out of their mouth that they're promoting health and wellness. They're reducing risk and complications. Okay. Okay, to the patient, right? They're linking them to different types of education and resources and all this. Either they're doing it or they're finding community supportive linkages out here, because they ultimately what they really want to do is make sure that these social determinants that are out here in the world don't continue to be a net for the particular patient that they're supposed to be serving, shit like that. Because what is the goal? The ultimate goal, the objective is to ensure that the patient's health outcomes are optimized, right? This is what they're all saying. This is what they're all saying. This is what they're all writing in these grant proposals and things. I think millions and millions and millions of dollars. They're putting it in their visions and their mission statements and shit like that. We want to see. We want to see where it's really, what are you really doing? And it's not everybody, people. It's not all these people. It's not all these entities. There's bad apples in every bunch, right? It's not the overarching agency and things like that. All right. It's the employees. All right. And that's the case in every instance of everything that you see where it's been exposed about wrongdoers. It is the individual. It's the person. It's the employee. It's that person. It's not the business itself or that in which whoever had the great mindset to come up with this vision and this mission. And these are our goals, and this is what we're going to do, and all of this stuff. It's not that. It's the people that they're putting in these roles. They're fake. The people are fake, and they fake and they lie and they play and they get these fucking roles, and half of them ain't even qualified for this shit. They're incompetent, they're disorganized, and they want some bullshit. Like Wendy Williams, Chief Operating Officer over there at Southeast Mental Health. She ain't bit more got no fucking skill set. She ain't no leader. No, she's not. She is not a leader whatsoever. And she damn sure don't give a damn about patients, okay? Now, about 5, 6, 7, 8, 9, 10 times, she has been sent an entire bulleted list of updates on the several times that a particular advocate for a disabled man in the mental health population has requested several things. Because Wendy Williams and Dr. Abu Hassan of Southeast Mental Health, 16 West Long Street, Columbus, Ohio, 43215, not only discriminated, which HHS has the awareness, the Civil Rights Department, because they just investigated so-called 23-513689, Arthur Salazar and Joseph Rangra. Arthur Salazar, he came on board because he wanted to know about, when was the Medicare fraud that Southeast was participating in reporting, right? So it's Medicare fraud because they're actually billing for services that they've never rendered to a disabled man. Excuse me. So that's where the fraud comes in. You're billing for services that you never provide and they just don't exist. Okay, with respect to him, I don't know what the fuck they're doing with other patients, but 9 times out of 10, if they're saying that they're providing particular services for this person, they never have counseling services. They're billing for the same thing for everybody, and they're not really doing it, okay? So they're pissed that now eyes are more than likely on them about the wrongdoing. And, lots of severe penalty comes out of fraud, especially Medicare, okay? So they don't want the eyes on them and they don't want that, or they're pissed because they've been found out. And the person that found them out, the disabled man's advocate or whatever, they want to make sure they're not associated with the business anymore. So they're going to revoke his right to care at this particular place. First of all, this is a whole community mental health place. Okay, the taxpayers and the funders and the grant money pays for this place, and it actually pays for it. So this person who's in the fucking community who has a mental health issue and is disabled can get his fucking care from this particular place. Who the hell you think you are, Wendy Williams? Who the fuck you think you are? You and Dr. Hassan's ass who sat up here and tried to write a damn prescription for a vilified 5 milligram or 10 fucking milligram, which was the wrong shit, when the patient hasn't been on the shit in 7, 8, 9, 10, 11, 12 months because the shit was making him have syncope episodes and fall out and seize and bust his head, have concussions and staples and all. What they got going on over here that ain't nobody paying attention, don't nobody give a fuck, but they telling you constantly, go ahead and let us know. Excuse me, Arthur Salazar, Hello, Arthur Salazar? Over there, Civil Rights, HHS. I mean, what the fuck? Who were the oversight at? There ain't none. These are liars, all right? So Arthur Salazar, he was sent a damn message. He's the one that stated that he needed the information on when the Medicare fraud was actually reported with respect to Southeast Mental Health and their billing for services not rendered after Nidra Davis of the Ohio Attorney General's office and her colleague showed up at the disabled man's house and had a whole long list of all these charges and all these practitioners ain't never been heard of, billing for shit that they've never ever done. Okay. And it's Medicare fraud because that's his primary insurance. So you bill Medicare for the shit. They might be billing Medicaid too. That's his secondary. Who knows? And they raking in. But truly their focus is not on the patient and the health and wellness of the patient, their overall optimization of the healthcare though is it? And who's gonna do something about it? All right. Getting sick and tired of it. All right. These people not serving the community, not doing shit. All right. That's why we had to go develop our stuff. Right? And who got the capital, who got the money, want to invest in what we got to do? Because we got the true vision where you can see the true results. Guarantee you ain't gonna have nobody like advocate coming talking about the bullshit or what we do. We ain't got the capital though. But see, that's what they do. They give it to people like this. And all they're doing is abusing. It's not true, it's fake out here, what they're doing. I'm telling you, and it's gonna stop. Anyhow. Yeah, so yeah, Arthur Salazar, we on to you. Now, so that particular case, when he said, I need to know about the Medicare fraud when it was reported in order to even do the investigation on the discrimination charge 23513 right? Well, a subsequent complaint was put into HHS, which is 23535-857. It actually landed on Arthur Salazar's desk. But what the complaint does, it tells about the continued discrimination and the retaliation post-submission of the initial discrimination complaint to HHS, right? But it names Arthur Salazar in it. It says that Arthur Salazar and Joseph Bradford were to, investigate this. They were told about the fraud and all this type of stuff that he asked about and everything like that. Well, it landed on Arthur Salazar's desk. So he went on and closed it out. And so what he's doing is trying to close out that case to make sure there's no real awareness about it, public awareness or otherwise. And he's not going to investigate it, even though he really does have the awareness of each and everything that's going on and the patient rights that are being violated, the discrimination, the retaliation that is coming post the report of discrimination, post the report of fraud, not only to HHS, because he asked about it, but also to Ohio Attorney General. Okay, everybody knows everything about what these people are doing, okay? But Arthur doesn't want anybody to know the underhanded shit that he's obviously doing, right? Okay. And each and every email thread, even up and through the last email sent to Wendy Williams, which also alerted her that she had no business sending out a patient's personal health information that actually happened to come across my email. Okay? I'm not a part of your interprofessional disciplinary team. I'm not on the treatment team for this patient. I should not have none of this information about this person. It's a female. I shouldn't have no information about that person, her first and last name. I shouldn't know she's being treated over there for anxiety. I should not know that she already had to get rid of one of the employees at Southeast named Sylvia, or Lord knows what the fuck Sylvia was doing to her and shit like that. Okay. I shouldn't have none of that information. It's even a phone number in there. That's probably her phone number. Her email address is in there. So at gmail.com email. I know who her case manager is. I know that she was termed at Genesis. I know that she's supposed to have some type of unassociated terminated that relates to food. And this care manager is telling her, saying in the notes that they actually did try to take her to the pantry or link her to the pantry, and she was resisting on all that type of information. It's personal health information, and it's actually with a mental health facility, and I should not be privy to because essentially I'm a lay person. Okay, they all know I'm a nurse and all this type of shit because I'll be in their ass. All right, but that's neither here nor there. Just as easily as Wendy Williams sent that message to me, she could have sent it to anybody. She could have sent it to you, and you'd be like, "What the fuck is this?" But now you know that XYZ. You got her name. Now you know that Betty Jones goes over there to Southeast Mental Health for mental health treatment. Do you know people don't want folks to know about their mental health and that they seek a treatment and stuff like that? It's a stigma associated with it. And society has done it. But people don't want you to know. And then people looking at her when they see Betty at the grocery store like, hey girl, I got an email. Somebody has sent me an email from Southeast, Wendy Williams, Chief Operating Officer over there. She sent me an email. We know the text that you had sent to that one dude, Rich Gilmore, you sent the text or something telling him that Sylvia, who was Sylvia? That was some case manager you had before, girl. What she do? You had to cut her ass off. I know that's right, girl. Fuck them. I know that. I know that's right. We cut the bitch off too. But yeah, 'cause ain't no tell. They be billing. What's they billing this shit to? Yeah, I know somebody else that was like billing his Medicare and stuff like that. They talk about they gave their counsel service. Bitch, who you counsel? Counseling. You know they don't be counseling. They don't even answer the fucking phone down there, but it goes to voicemail full. And you know what, girl? He told me, he said he had even told this lady, they Carly Tennant at Adam of Franklin County. She's like a clinical director or something like that over there. He had been telling her for months everything that they had been doing. He even told her about how Ohio State Garden had abused him on April 14th, 2022. He even went and told about like how Ohio Disability Rights of Ohio Nellie Pratt and Keisha Towns was acting like they was gonna be advocates, and how he had told them while he was still in that fucking hospital what had happened, the abuse and everything. And they got his medical records and they looked at everything that had happened to him and that sensitive information, and they never did shit. They never investigated. And then you know what? Ohio Disability Rights of Ohio had the audacity to call her the girl. They sent him a letter and they said, you know what? Your medical information has likely been breached. What the fuck? And he told me how he had somebody go in and alert HHS about that too, about the HIPAA medical confidentiality breach and shit on his sensitive mental health information, shit like that. But he had really just like cold sense. Information. Shut up. Disability rights over Ohio. They was turned in for that breach of that data and shit like that. Because they said in their letter, they was like, look, now the employee who doesn't work here had the email of the employee that does work here. And so your information could have been breached. Yeah, but we don't give a fuck. We'll send you the letter and everything like that. But ain't shit you gonna be able to do about it because ain't no real advocate support out here for no person with no damn mental illness. I ain't no vulnerable population. You know it, don't you know it, don't you know it, girl? I fine. Boom. God. Girl, get them though, girl. Who you gonna tell on him? You gonna tell CNS? Health and Human Services? You think outside South are gonna do something about it? Or you think he gonna sweep it under the rug, be closing out cases so he'll never get found out? And you have put, girl, let me tell you, he has sent in something to that Arthur Salzar too. He like investigated one so-called, you know how that goes. Then they sent in something else. And look, they retaliating and everything. Arthur sent his name on and shit like that. He's like, you know, I half-assed investigated this other one. I don't need nobody to know that. Let me just close this out and say some dumb shit. Like, we don't investigate fraud knowing that the secondary complaint 23513-857 was really a discriminatory complaint to let you know the discrimination is still continuing and now they're retaliating. But you trying to sugarcoat shit and make it look good on paper as if somebody sent in something telling you about fraud. Boy, shut up. And also, if you don't investigate fraud, would you ask for the information about when the reported fraud to Medicare took place anyway in the other damn case, 23513-689, then Arthur? What's that, Art? You need fired. Damn it. Donnie, girl, okay, go back and tell me what you were saying about what happened. Sylvia, what's Sylvia? She never take you that mother. Food pantry was giving you like chitlins. Girl, we are Muslim. They was giving you chitlins and shit like that. See, that's what I'm saying. That's why I don't know. I'm glad you getting them told. I'm glad. Oh, you had hired that one lady, or you had reached out to that one lady. She's a true patient rights advocate and everything like that, and she don't tolerate the bullshit. You call her, she be on their ass, don't you? She be on their ass. Don't nobody like her. Nobody likes her because she's always on everybody's ass, the wrongdoers. Yeah, it happens all the time. It happened for years. And she goes and works places and she be exposing them and she be calling them on. And she's like, excuse me, can I get the policy on that? What's your standard operating procedures for that? Have you updated the policy yet on, because you said that, I mean, your policy says this, but now you're doing this. Oh, it updated. Can you give me the revision for that? Did you go back and do an addendum? Oh, you didn't? I mean, well, what the fuck? Just putting people at risk. Huh? It's putting their health and safety at risk. And also, some people work here, they got licenses. They got nursing licenses, they got social work licenses, they got pharmacy licenses, they got all this type of shit. And you put a license on the line for participating in this shit. Because if somebody bring a legal claim, every motherfucker involved about to be pulled into the shit. They gonna ask like, excuse me, nurse. And why did you document this again? Why did you put this here again? Oh, because they told me I was supposed to write it like that. And, they told you. You're supposed to. And you just do whatever somebody fucking tells you to do. Did you not go to nursing school and nursing 101 told your ass, don't you ever put your damn nursing license on the line? Don't you ever put no shit in somebody's record that's not true? This is not true. And you know it's not true. Now, why didn't you advocate for the patient when that lady said and told you to put some shit in this record like that? When she sat up here and she told you to go back and put something in there that wasn't true, when you really didn't even talk to a fucking patient. You went in there and you said the patient refused to answer. You wrote that, you said that, but you had never called the patient back. And somehow the patient got smart. And they said, I'm getting ready to just request my damn medical records. All these facilities and practitioners that got my medical records and shit like that. I'm gonna tell them, I said, listen here. I got the right to have my medical records. And I'm gonna put in a high-tech patient record request. It's only a flat fee of $6.50. That's a requirement. I want a high-tech medical record request. Give me my shit. Thank you, Jesus. Well, I'm gonna go on and get my medical records. I think I'm gonna take them over there to that girl who's the advocate, but she's also a medical record audit reviewer, abstractor, overreader for quality and performance measures. And she's really good with evidence-based practice. She's also a legal nurse and a life care planner too. And she's been a nurse for a long time. And she knows what the fuck she's talking about. And she goes through to different types of bullshits and shit like that in her own for herself. And she got this son that's schizophrenia. He had a first psychotic break. Yeah. Unspecified psychosis and delirium. Been in and out of the psychiatric hospitals and shit like that 3, 4, 5 times. She's pretty much an expert on crisis intervention and collaborating and things like that with the community and first responders and all this type of stuff to try to get some shit together where everybody can be on the same page with how critical it is to communicate and collaborate with all the different stakeholders and parties involved in ensuring that in crisis intervention, everybody is safe from all different areas. She does that too. Wow. She said she was working on something too. There's going to be an all-encompassing type of a community resource center that has all these kinds of things. It has those types of services where they help you with matters where you need advocacy. Not legal. They might give you legal advice. Education and guidance and resources. It's not legal advice. She's not writing up no motions and submitting no pleadings and shit like that for you. She know how to do that too. She does know how to do that. She ain't quite the expert. She ain't no. But she gives credit to Capital University Law School. Yeah, in Columbus, Ohio. She give credit to Bill over there because it's a hell of a school, baby. It's a hell of a school. It equipped her with a lot of knowledge. And it was this one lawyer teacher. And the lawyer teacher said, I tell you what, even though you guys aren't attorneys, you sure enough have enough information now where you could go into a court, even for yourself, and be one heck of a spitfire. Wasn't she the greatest lawyer of all time? And she's the one that taught us. Yes, she did. She was the main one that taught specifically how you submit certain things to. We like her. We thank her. We thank Capital University Law School and things like that. Yes, we absolutely do. But yeah, so this person, she said, hey, we'll put together this community place. It's all encompassing of everything that she talks about, where she's been doing these observations and self-longitudinal study. Okay. Just observations and talking to people in the community and talking to people around, but also going through certain things for sale, personally, Also with those family members, like your son with the mental health issue, but also her granddaughter who has ASD, she's autism. And she sees with each and every instance how all these key players in the healthcare system, all these people in the interdisciplinary team aren't taking 100% responsibility individually for what they're doing when they should. We don't take just a piece of the pie of responsibility. We don't blame, hey, no, you didn't do that. No, the nurse didn't do that. The social worker didn't do that. You. No, we all individually have 100% responsibility to our patients when we're in healthcare. And if you're in healthcare and you don't fucking know that, get out the fucking field now. Get out now. You are 100% responsible for what you do. You are responsible. You will take accountability. 100% is no one else's fault but yours. If you are a social worker, 100% responsibility. If you're a nurse, 100% responsibility. If you are a doctor, 100% responsibility. Nurse practitioner, PA, specialist, 100% responsibility. We're not blame game and all that. That's done. So social worker, if you're out here and you're not truly linking people to community resources and supportive linkages and things like that, and really delving in and helping them, really doing assessments to find out what's going on, then you're a whole piece of shit and need to go. Right. So we just had somebody send a parent of a child with ASD who's 4, nonverbal, says some things, but just pretty much repeats and things like that. Does not quite have the communication yet to safely be in a preschool or something like that, because she cannot come and tell if something's going on, or somebody is abusing or mistreating her, and she's not going to follow certain types of directions that other students may follow. And then she screams and she runs and things like that. And people who are not trained in a specific area to deal with autistic children might become, abusive or things like that. Yeah, we've seen that before as well. We've seen where a child with ADHD at a daycare called Kids Planet at 6011 Cleveland Avenue, Columbus, Ohio. It's Westerville, Ohio, which was reported also to the Child Care Licensing Board. We've seen there also where a teacher there, Rabia, consistently pulled and dragged on a child with ADHD and some behavioral issues specific to his diagnosis, where that particular daycare is not the appropriate setting because they cannot meet his special needs, okay? They cannot meet his special needs. And the teacher is overwhelmed because why? She has a whole classroom of kids where the child ratio requires her to pay attention to each and every one of them. And this particular child, however, with ADHD, more likely than not, actually needs one-on-one, okay? Needs an IEP, needs to be in an environment that's therapeutic for him, specific to his special needs, right? Like maybe ABA type of therapy setting or something like that. But we don't know, but we do know, we did bring it to the attention of the owner, Kata Howe, and we said, listen, Kata, you're gonna need to talk to the parent, because what we witness here is unacceptable, it's inappropriate, and actually constitutes child abuse and neglect. Your teacher should never be putting her hands on a child like that. Okay, all right. Go check the cameras at Kids Planet 6011 Cleveland Avenue. All right, from what is it, May 23rd to like May 31st or something like that. I don't know. Go check the cameras. Go check it. All right. And you'll see that teacher pulling and dragging on that boy and making him sit in timeout. All right. Things like that's not appropriate. Now, that was reported. We don't know what they did about it about child care. 9 times out of 10, licensing, nothing. Because Kata Howe already told her. She said the investigator for child care already comes and tells her, gives her tools and tips, and is buddy with her on everything that any parent even tells. You need something? Yeah. Okay, so that was just a side little tip note for you, so you know that that is happening as well. So anyways, some person, some so-called caseworker from nationwide children. We love nationwide children. We love them, but they need some education. And most of the time, all this is that these people, they need to be educated more. And that's what we try to do. We actually try to give the education, in fact. We try to stay behind the scenes and just say, hey, here, listen, let me give you this awareness. This is inappropriate. This is not okay. This is outside of clinical guidelines. It's against standards of care. Evidence-based practice doesn't support your actions. And in fact, you're violating your own professional and ethical codes of conduct and things like that. And let me give you some research that says this, and let me outline, not yet. It's probably gonna be like one. Why? Because that's how it usually comes. Or 12. So let's check again. Let's see. Last time was 12:19. So let's check it 12:19. All right. 11:15. It'll definitely be there. All right. What was I saying? Yeah, so basically that's all that we do pretty much is kind of give the tools, tips, and education to these particular entities that have pretty much been deemed the wrongdoer. We really do behind the scene go and give them advice and guidance and recommendations, and we provide them with the authoritative research bodies out here that can substantiate anything that we say. So we don't go here and we don't tell people anything without the backup. All right, the backup is the evidence. So evidence-based research. So we go and we provide them things and everything like that. And Arthur Salazar and Joseph Regra should be able to give you an example as well, because what Southeast Mental Health was doing, Wendy Williams, Dr. Abu Hassan, 16 West Long Street, Columbus, Ohio 43215. What they were doing, they were trying to, in retaliation, for just having to catch them on everything. Say, listen, that person that you're saying as a nurse isn't even a fucking nurse. And in fact, she failed the LPN. I mean, why are you saying that she's a nurse? And what's up with the PA? This doctor yours getting ready to go out of the country for 2 months. We need the medications, okay? And they wasn't fucking worrying about the health and wellness of this particular patient when that doctor went out of the country for 2 months, didn't they? They weren't worried about scheduling appointments then, were they? They just called in the meds for 2 months and never called and never did shit. Okay, how about that? All right. All right, so let's just keep it all real. Let's keep it 100 done. Okay, and let's be transparent all the way around. So they sent an email, Southeast did, talking about, well, the nurse is going to process a PA. The PA, this bitch wasn't no nurse. She wasn't no nurse. It's easily, you can look it up. You can go verify people's licensures, okay? She wasn't a nurse, but she tried to take the LPN test and she didn't pass it. So hopefully she get back to it and she keeps studying and she passes it one day. Nothing really against her because she didn't self-proclaim herself to be a nurse. Somebody said she was a nurse. Bitch ain't no nurse. And she doesn't know how to process PAs, okay? What she did, she further delayed the medication refills and things like that of the patient who actually was out of medication for a few days because of her negligence, okay? Because what she did was she filled out a PA, but she sent it to the secondary insurance, which is Medicaid. So she already doesn't know what she's doing. Bitch, you're supposed to look up and see who's the primary insurance, who's secondary. Primary insurer is the one that has the vendor for the pharmacy, for prescriptions and stuff like that, right? So his primary insurance is actually Medicare. All right, so she got sent it to Medicaid. We following up like what's going on with the medicine? We're going to medicine, and then we just say, hey, we got to do it ourselves. We got to do it ourselves. Call Medicare. They're like, we don't have anything. We don't have a PA from there. We'll send over something. We don't even see it, man. We don't even see it because it's like, what the fuck's going on? Well, Southeast, they don't want to admit that a mistake was made because they didn't know we was on the back end already, cleaning up and trying to find out what the fuck this so-called impersonating nurse did. What she did was she sent the PA to Medicaid, which is secondary. They don't cover it. Further delaying his medicine. Okay, it was to go to Medicare. So what we had to do is send a email saying, listen, this is who you need to send it to. Why did you send that to Medicaid? This is Medicare. This is who the vendor is. You need to call them. You need to get the PA, and you need to expedite it. Okay, so we got to go in and tell them what to do. They ain't paying us no check for that shit. All right, but they get mad when you catch them doing something wrong, and then you put a corrective action in place. All right, they don't like you, an outsider, telling them anything, and you telling them or giving them a damn corrective action. That's actually going to save them in the long run because all these people are headed down the road of getting sued and not being in business at all because somebody's going to get killed by these people. I'm telling you, and nobody's going to ever be able to say, that nobody out here in the world didn't have the awareness. If this is your awareness world, it's your awareness universe. So I'll be damned. Don't let me see nothing on no damn news about none of these people that already said now somebody done died. Now they gave you the awareness, all the bad and wrongdoings that these motherfuckers is out here doing. Nobody stepping in, nobody doing shit. So don't nobody act surprised and woe is me and send the praying hands and the emoji tears faces and shit like that. Okay. So anyhow, River Vista Health and Wellness on April the 1st, 2021, Ohio Department of Health went in. All right, they did an on-site investigation, including observations, record reviews, and interviews. The investigation was limited to determining whether River Vista Health and Wellness met the federal requirements for participation in a psychiatric hospital in a Medicare program. All right. This is what the state's investigation substantiated that. It substantiated that based on this complaint. Now, where's the remedy for the patient that this complaint stemmed from? That person is a victim and they've been harmed. Who's done anything for that patient? Who did anything for the lady that was punched in the face? Who did anything for that? Nobody. All right. Well, where's their compensation? How they made whole? I mean, what's up? Let's let it be known now. Let's get in here. Let's talk about it. Okay. River Vista, Ohio State. All right. We're not done with Ohio State. We'll come back and let you know all about their shit and all their bullshit too. But we'll put up receipts. We'll put up receipts. We'll come back. We'll put up some more receipts and shit like that. All right. Now, all right. So now, what did River Vista do? What did they do? They failed to meet the Medicare condition of participation of patient rights for failure to ensure patient protection from abuse. So what's that mean? They're not protecting people from abuse. But where did they get that from? So a patient and or patients had to have been abused. Who are these patients? Who is this patient that they did not protect from being abused? Where are the attorneys that's getting ready to come in and file a class action on their ass or something like that? Get these patients compensated and some remedy for their damn harms, but these people were abused, right? So patient protection from abuse. That means there's evidence that somebody was abused and River Vista, right, did not uphold the patient right. And they failed to ensure that the patient was protected from abuse, right? Right. All right. And so HHS has the awareness of this. There's a complaint that's specific to River Vista Health and Wellness. Joint Commission has a complaint about this. There's a complaint specific to the same complaint that CMS received. Catherine Reamer at MHA has the complaint. She was supposed to have her licensure person go and investigate the hospital. Okay. What she did was she lied. She said that they did investigate and that they found that they already addressed the complaint and, but then she was provided in reply to what the fuck she said, a copy of this particular letter that CMS stated that there actually was substantiated evidence that they were River Vista Health and Wellness in violation of many patient rights and abuse, neglect, and records confidentiality breaches and all this type of stuff. Then Kathleen Reamer, then she wanted to clean it up and be like, oh, that's not what I'm saying. Let me find out if I can get some more information, this, that, and that. And we never heard from her again. So we're trying to figure out, like, where is the follow-up? We need that still now, okay? Anybody gonna swoop in? FBI? State Inspector General? Department of Justice? Anybody? All these people need investigated and sanctioned. And these patients that's been abused, that they didn't protect, where the remedy at? Huh? All right, so basically, let's go back because a little bit of an interruption, okay? So River Vista Health and Wellness LLC failed to meet the Medicare condition of participation of patient rights for failure to ensure patient protection from abuse, patient medical record confidentiality, and compliance with hospital policy for patient restraints. So you got abuse going on. Who are these people that have been abused? Nobody want to talk about it because don't nobody give a shit because they're mental health patients in the vulnerable population and don't nobody out here in society really give a fuck, but always hollering and screaming, talking about mental health awareness, mental health matters, mental health day, mental health month. We care. No, they don't. And they know about this shit. Hello? Where's the original complaint that CMS received? All right. The complaint number or the file number is 364-061-69C. Where's the original patient that this complaint, where this stemmed from, that gave this awareness, that sparked this investigation? And then you got the evidence right here. Where the remedy at? Or where the money reside, or where the remedy reside? Where the remedy reside, where the remedy reside, where the remedy reside. We ain't playing with you wrongdoer. So public opinion does matter, absolutely, right? Because this, you should have interest in this. This is healthcare, and it can affect you. You're not immune to mental health issues and things like that. Not anxiety, not depression, not panic attack, not PTSD, all right, not psychosis, not delirium, none of that. Not first psychotic break, none of that. Not feeling like, you got some type of suicidal ideation, homicidal ideation, or anything like that. Not feeling like you might want to harm somebody or harm yourself. Okay. Not out the blue, something doesn't occur, you having delusional thoughts or hallucinations or anything like that. You're not immune to it. And neither is your family. Okay. But the only time that people really want to give a damn is when it is them or when it is their family member or somebody that they love. Okay. No, we ain't got that. We give a damn now about everybody. We was giving a damn about everybody in the vulnerable population of people before even our very own son, the first psychotic break. Okay. We've been caring for them. Okay. But yeah, so but they give all the money and all the grants and all the millions to these folks out here that's half-assed. All right. They give them bullshit. I'm telling you, these people are taking these folks to stores that are these so-called free stores, and they're giving them dirty, nasty, funky things that are broken, that are not quality whatsoever, that you really should have thrown in the trash. They stink, they smell like poop, pee, they got stains on them, strings hanging out. I mean, zipper and stuff like that don't work. I mean, holes in shoes and dirty and things like that. That's what they think of you out here. Just because you're going through a hardship and hard time in your life, and you need help, you need a leg up. And it can even, and what it takes lots of times is for people who typically haven't been in this particular population of people, but they've been living their best life or something like that. And but they end up, something traumatic happens, and they end up having to experience a crisis, which creates those social determinants that they were once able to meet. It creates a dilemma to where they can no longer meet these social determinants anymore. And then they are put in a position and they have to walk in the shoes of the very population of people, the vulnerable population of people that they were outside in society kind of looking at like, or like not really understanding, all right, what it really is. But lots of times that's what it takes, is for you to be put in that crisis type of situation. And you have to participate in these assistive types of programs. You have to apply for food stamps. You have to sit up here and be on WIC. You have to find some type of transportation or whatever through your healthcare provider. You need resources, and you have a case manager that really ain't doing shit but Googling stuff and sending you prints out of shit that has nothing to do with whatever you need specifically. It's not really individualized at all. It's just some bullshit that they can print off real fast and copy and paste and put in a medical record or something. And it looks like they're really doing something, but it's actually not specific to you. It's actually not individualized. They actually did not sit down and do any type of assessment whatsoever and get your opinion as a patient, patient-centric, on what you feel equates to quality of life for you. What do you feel goals? Do you have any goals for your own health and wellness? What are you willing to do? What efforts are you willing to put forth that you feel that you can obtain? All right. And are those things particularly measurable in a sense? Like, can we assign a date to where we can kind of see how you're progressing towards these kinds of things? Are you going to allow me, patient, to help you? Can I give you some recommendations and some insight? Maybe I can give you some testimonies of other patients that utilize this particular education and information and intervention, and they applied in their life. And this is what they reported back to me. And you can draw from that, whatever it is that you will, to see if, okay, well, let me try that. Or no, I know for sure that's not going to work for me. What is that? Oh, the rice diet? Well, XYZ things, the items that you're saying that I should eat, I don't eat those, I don't do that, that's not gonna work for me. And you ain't, so you can't be sitting up here talking about, Well, you need to do the right stuff. And if you don't do the right stuff and do it like I said, then I'm just gonna, I'm gonna have to let the chief operating officer know that you refuse to do what I told you to do because you didn't follow exactly my treatment plan because you can make your own fucking decisions as a patient of what the fuck is gonna work in your damn life. And we just gonna we're gonna discharge your ass. We're gonna get rid of you because you don't want to listen to everything we said. And then you sat up here and you put in a complaint to Health and Human Services, Arthur Salzar's ass. You went and you told him everything you was doing. You went and you told him that we was trying to revoke your fucking right to participate in telehealth services and stuff like that. And we even had to send Arthur Salzar and Joseph Raver a fucking copy of their own shit that comes from their own agency that they work for. HHS sent out a whole immediate release talking about the non-discrimination of people, and you need to make sure that you allow people to participate in telehealth services if it helps them meet their healthcare goals and it optimizes their healthcare. But Southeast, Wendy Williams and Dr. Abdul Hassan and all them motherfuckers over there trying to make life hard for a disabled man who's in a stable position trying to get better. They said, we're going to revoke that telehealth. We're going to make him come down here because what we're trying to set him up. And when he come down here, and he gets triggered and he goes off and he fucks somebody up and the officer got to jump on him and stuff like that. We're gonna be like, oh my God, he put us in an unsafe situation. He's insane. We got to immediately terminate him because he went off on us and he attacked us, but we already knew that he could. But then this advocate kept saying, just let him do his appointments at home in his own environment. He's okay, he's safe. Or you guys can come to his house and do it here, like how you did do, and everything was fine and stuff like that. Like, no, damn. You done told the fucking government what we was doing, our eyes on us and shit. Hey, we can't even bill for services no more. She done told it. Damn, you told them we was like faking, like we was doing counseling. We was faking. Oh my God. It's all true. It's all accurate. They so fucking stupid and dumb. Anyway, they do it to themselves, like I said. Southeast Mental Health, them motherfuckers, they sat up here. What's her name? Catherine Goldenwaller. She sat up here. She's the one that submitted the letter to the Ohio Probate Court Magistrate, saying she was a counselor at the facility that the person who was seeking the advocate was seeking guardianship of a disabled, mentally vulnerable persons. Just seeking guardianship. Guardianship is not you revoking their rights, so don't get it fucking twisted. That's what Southeast thinks. They think as a guardian, you can just do whatever fuck you want to do. No, you can't. You can't do that. You can't revoke their rights. They still have you. Southeast ain't even notified this person yet that they discharge him because they discriminated against him and all this type of shit. You're supposed to notify the patient. First of all, it's minimum like 30 days. Okay. They don't have no real reason. He hasn't done anything. He hasn't done anything. All right. So they abandoned him. They put him in a real bad place and put him at risk for complication. And in fact, if something happens to him adverse, because they did that, they're going to be held liable. And it's out here in the universe, and everybody fucking does and shit like that. And ain't nobody stepping in, nobody doing shit about it. That man should be able to still participate in services at Southeast Mental Health, which the only services that they really offer is just an appointment in order to get the medication refills. He just needs the medication refills. All right. So what the patient has also asked, and Wendy Williams and Dr. Abdul Hassan continue to ignore, and Arthur Salzar and Joseph Rangel are on the email threads, and they have been on everything. So they know everything going on. They know about the personal health information that Wendy Williams sent out there on the email thread. Mm-hmm. They know everything. They have all the emails, and there's even more emails and things like that from a long time ago where these motherfuckers have been put on tabs. They know that the Adam Board of Franklin County, Carleton have been knowing about this. They know it all. Okay, they're not doing anything about it. All right, no, they're not. So yeah. Arthur Salzar and Joseph Ranger know that there were very bulleted, pointed questions asked of Wendy Williams, chief operating officer, when she sent abruptly out of the blue some letter stating that Southeast can no longer effectively treat the patient. They don't have no reason. Like, huh? You just had an appointment, a telehealth appointment. Well, it was an appointment where the doctor came here face to face and brought like a nurse and all of this, and like that was what they were doing to put on the show for HHS, to make it seem as if they were doing this. And you could tell even in the what they were doing, it was a change in their approach to care. They were actually trying to make it seem as if this was their routine approach to care that really would, if you were looking at it, you didn't know the whole situation. You said, oh, okay, that's quality care. Okay, they're following up, they're doing this stuff. That's not really what they actually do. And that's not really what they were actually doing prior to the report of discrimination of being put in. It's all a game, it's all a trick. And Arthur Salazar probably then told them, well, this is what you got to do. You got to get rid of them. And, because they know what y'all doing. We ain't gonna do nothing to you. I mean, who knows? Who knows? Because why ain't you really investigating? Why ain't you holding them accountable, Arthur Salazar? You got all this fucking information for Health and Human Services. I mean, what's up with that? FBI? Huh? Department of Justice? U.S. Inspector General? Okay. Investigation needs to be done on Health and Human Services, Arthur Salazar, Joseph Rundgren, okay? All right, also Wanda, what's her name? Wanda, what is her name? Yeah, something like that. I don't want to switch my thing, but there was another case. Now this particular case was the Ohio State pardon, the abuse and everything. They had it was actually, I put it on Twitter. So go to Twitter, Nick Dick 444. All right. So it's NIKDIK 444. All right. Every single day, we're going to keep on exposing the wrongdoing and things like that. But HHS had assigned a particular case. It was a complaint about the abuse and everything to that girl. I think it was Wandy, or something like that. I have all the information, but I don't want to click off of this. I've said it before 100 million times. And she stated that she actually had been assigned that case to do the investigation. But then when she seen the complexity of it and all the evidence and everything like that was associated with all the different parts, there's a lot of different players that were involved in the wrongdoings and all the illegal activity and unethical behaviors and things like that, where some true sanctions and penalty, and even in fact, perhaps some criminal charges and things like that would have had to come down the pipeline. She backed out of that shit. And in fact, she had one case assigned number, and then it switched to some other type of case assigned number. We don't know what that was. We got them both. So to make certain that any evidence that was sent to her under that initial assigned investigatory complaint, yeah, is associated with the other. We want to make sure because we're putting it out here in the universe, and we did actually turn it into the U.S. Inspector General, the FBI, and everybody. Yeah, so any and everybody that is somebody knows about all this shit that I'm on here telling you, okay? These representatives out here in your Senate, in your House, in your Congress, and all this, they all know all of this, all right? Like I said, even Attorney General here in Columbus, Ohio has the awareness. The Attorney General, they will investigate abuse of like nursing homes and things like that. They do not investigate abuse for psychiatric hospitals, but they have the awareness. Now, Nidra Davis, she's an investigator for the Medicare fraud. Okay. She showed up here with her colleague and she had all this information, and she too was able to confirm, say what the charges were, and those charges that were actually billed, that services were never rendered. But she half-assed and she really didn't do any investigation whatsoever. All right, so it's a lot of key players, and they all need investigating. They all need held accountable. All right, because they keep on playing games, and actually they're playing games and toying around with the lives of patients. All right, when patient protection is the key, right? Patient protection, their rights and otherwise, all right, need to be protected. And then when people go and violate and abuse and neglect and stuff like that, there should be penalty involved, just like it is in a regular world. You go and you abuse and you violate and you neglect and you do all this type of stuff, there is penalty. All right, but this population of people, nobody gives a fuck about. And they also know that this population of people, they can't afford attorneys and stuff like that. They don't know how to self-advocate. They damn sure can't represent themselves as pro se and anything like that. So that's how they keep their foot on their neck, okay, and keep on getting type of their own benefits, monetary benefits, or whatever else at the detriment of these patients and stuff like that, while they're kicking their ass, putting them in restraints, shooting them up with meds, taking their rights, not explaining shit, not doing shit all the time. All right. Now, who's going to hold this CMS? Not CMS. Who's these people? River Vista. Who's going to hold them accountable? All right. So we need to make sure we find out who all the patients are that were abused, and River Vista didn't protect them. Okay, and also that lady who, that man at River Vista had punched in the face. We want to know, we go back and say, where's all the incident reports that was written on that? Was the ambulance called? What type of medical attention did she get? What type of follow-up was that? I mean, what really happened? The man that did that to her, that's assault. I mean, even though you're in a mental health hospital, it's still a criminal act, right? So were charges brought against him? Was there a police report ever submitted on that? I mean, that he can be a danger. All right. All right. So I mean, that's the bottom line. Whether you have mental health issue or not, you have to be controlled by some type of mechanism. You have to self-control yourself, or however you feel you need to do that, whatever mechanism, couple mechanisms you need to put in place. And it might be inclusive of medication management. And if you're not able to do that out here in society, where everyone, including yourself, can be safe, then you're going to have to be in an institution, and they're going to have to do what they have to do for you in there. You can't be out here putting people at risk. You got to be on the medicine. You got to do what you got to do and shit like that. All right, you got to. Okay, and these people know it. All right, so what they keep doing is putting motherfuckers back out here on the streets and stuff like that. That actually can put you at risk. They're not following up. They're not doing anything, and that's what they want to do to the disabled man too, right? They want to make sure he don't have his medicine. Wendy Williams, Dr. Google's son. See, they think they slick. They tried it, didn't it? They want to make sure he don't have his medicine. Because they know if you ain't got your medicine and stuff like that, number one, you're gonna start spiraling down. Them symptoms might return. You might get suicidal, you might get homicidal, you might have another psychotic break, you might get delusional, you might have hallucinations, you might get paranoid. They can see certain things, people happy and acting crazy, and you're gonna be back in the hospital again, all this type of shit. That's what they was trying to do. Yes, they were. Now the whole world knows it. They're gonna do something about it. Huh? Yeah, right? Well, even or they was really hoping like, or if we don't make sure he has enough medication, we kicked him out of our services and stuff like that. Yeah, because it was all perfect, like how the advocate wanted. He was able to do the telehealth, or the physician could come to the home and things like that, which is the best for that patient, optimizes health and wellness and stuff like that. No, but we wanted to create a complication, ensure that he keeps having all these unmet social determinants, and his incidence of complication and risk are increasing, that he's unhealthy and he isn't well. All these symptoms come back, and everything just exacerbates into the hospital. He's getting abused. That's what we want. And we so that because they're on to us, we're gonna just send the letter and get him out of here, because we want to keep abusing the rest of these patients and stuff like that. We don't want them to know what's going on and everything like that, because she thinks she's smart. That nurse, she fucking thinks she's fucking smart. He's fucking advocate. She thinks she knows some bitch want to give us some evidence-based practice shit. Like best practice evidence. We all look at that shit. We all know nothing about this too. We so dumb. All we do is send out people's patient health information and violate HIPAA and high tech. That's what we do. And we get away with it, yay. And we talk to the people down here like some bullshit. We be like, motherfucker, get behind the line. Motherfucker, did you hear what I said? Shut up. That's how we be talking to them. Yeah, we don't give a fuck. So we don't think that they mean anything. No, we just talk any old way to them. Do whatever we want. Yeah. Always have an attitude. Just sitting up there, tapping the long nails on things. Long hours, put it back on and bullshit like that, and not paying attention to shit like that. And not getting them fucking pulling them damn calls off that damn voicemail and calling people back and addressing needs and shit like that. Fucking with people and shit. Go look at their fucking reviews. Southeast Mental Health, Columbus, Ohio, 16 West Long Street. Now again, who gonna step in and make them do quality care for this disabled man that they just sat up here and tried to discharge by no fault of his own? He didn't do shit. They sent some letter abruptly out the blue for no fucking reason. They got a reason, all right. The reason is retaliation for the complaint to a governmental agency, HHS, right? About what? Rights violations and fraud. They're pissed. Yeah, so, but you should not be able to do that. Wendy Williams, Chief Operating Officer, Southeast, needs fired today and now. Catherine Reamer, MHA of Ohio, needs fired right now today. She had this exact same thing about River Vista. The complaint that sparked this particular investigation, same complaint that Kathleen Reamer had. And she claimed that her investigator was gonna go and investigate her licensure, and she claimed that the investigation was done, and they didn't find anything. The investigations were done around the same time. So, but your hospital licensure person, Catherine Reamer, didn't find anything. But then the oversight type of big gun governmental agency, CMS, assigned this to Ohio Department of Health, and they found this, and you didn't find it. What records was you pulling? What was you looking at? What was you doing? What's your processes? What's your auditing processes? Did you randomly go in there and just pick records and things like that? Did you interview anybody? Did you do this too? Did you observe, record record review and do interviews and things like that? Did you do that? Did you do that? I don't think you did, and I think you're a liar, and I think you need to be fired quickly today. Okay, all right. Same thing. Carly Tennant, Adam Bohr, Franklin County. You need to be fired right now today. They have all this information. Each and every one of these people have this information, the same information about River Vista Health and Wellness. All right. But the only people that were able to find that there were actual violations is who? Ohio Department of Health. Right. And the only reason why Ohio Department of Health did this particular investigation because CMS told them to. CMS really, from what someone at the Ohio Department of Health told me a while ago when I put this in, anyways, was CMS had to give them the jurisdiction to do it, but they can do it. So the Ohio Department of Health wants to do it because they have the awareness of abuse and stuff. They absolutely can. They can petition CMS or do whatever, but they'll just go ahead and tell you as a layperson out here, if you have a complaint, they don't tell you like, oh, we don't have jurisdiction for that. It's a lie. All right. So just stay abreast. This is just like for awareness purposes. But now what we want to know is there was a corrective action put in place for River Vista Health and Wellness. We want to know the follow-up now, right? That was back in 2021. We gave you plenty of time to put your corrective actions in place. All right. Now it's July, of 2023. We want to know what the follow-up is. So Ohio Department of Health, do you have the follow-up? Who's been going in and checking? Who's been doing pop-up on-site investigations and checking to see what's going on with the corrective action plan here? Who's been keeping track? Have they been meeting the expectation? Have they fallen below? Where's the write-up? What's the report? Huh? CMS, have you checked to see what the fuck Ohio Department of Health has done to come back with a report? You have to evaluate. You have to constantly evaluate and reevaluate. When you put an improvement plan process in, does it just end? It's over? No, it's not. So this is why I'm telling you that these people, they don't have any real qualifications. They are disorganized, right? And they're incompetent. All right. So anybody, so if you're a chief operating officer, does she have an MBA? Oh, this nurse does. Does she have an MBA? What the fuck are her qualifications? I mean, what is she doing? Like, what's her name? Wendy Williams? You know that. I mean, anybody that's oversight and leadership and stuff like that, okay? You could be a manager, executive, senior leadership or something like that. You know that when you are looking at putting in an improvement plan, any sort of modification, what do you have to do? You have to reevaluate and say, hey, this ain't working. All right, let's strategize, put something else in place. All right, let's see if this works. We're gonna do it for this long, however long. Then we're gonna come back to the table and say, all right, these are the changes that we said we were gonna put in place. See how's that working? And so you got to go back to the drawing board. You got to do the same process again, right? You got to interview, you got to do medical record review, you got to whatever they said that they were doing here. I observed and all this type of stuff. You got to get the feedback and all of this types of shit. All right, it's very serious, and they're not doing it. So why the fuck do y'all people keep giving them money? Huh? Why do you keep giving them money? Funders, stakeholders, government, grants.USA. Why do you keep doing that? They're not doing what they said they're set out to do, these LLCs, all right? But we got an LLC. Anybody want to give up some money to do the shit? Huh? Any angel investors want to get a capital? Hit a sister up. They're not doing it, all right? So what we want to know now is the corrective action was put in place, which is similar to like an improvement plan, right? And all along throughout any type of plan that you put in place towards improvement, there has to be periodic check-ins on how things are going with the processes. Is it going to be weekly? Is it going to be monthly? Is it going to be quarterly? Is it going to be annually? I mean, when are the check-ins, the evaluation points, right? How's things going? Okay. Oh, looks like that's working right now. Oh, that's not working. Okay. Because you might need to come in at some given point and say, wait, we already can recognize right off the bat, this ain't working. Boom, scratch it out. Coming back to the table. We're having a meeting on XYZ day, bring the whole interdisciplinary team in. We're going to have a collaborative discussion. We're going to brainstorm. We're going to get on track. Like, okay, this particular intervention that we put in place, all right, in the corrective action plan or improvement plan, it's not working. We see it already at the quarterly evaluation. Take it out. What else can we put in replace that? All right. And you really have to sit there and you need to talk and say, okay, why isn't that working? What are the barriers involved in this? Do we need professional development? What is it? Do we need to really bring in someone to educate, or do we need to actually add a particular curriculum to the annual in-services that we require of these people? What is it that we really need to do? Okay. Okay. So like I'm saying, these people don't know what they're doing, period. But what they did was they fucked with the wrong person's kid. And that's me. And I'm not done yet. I said, wrongdoer, your time is up. And I'm not fucking around and I'm not playing. And I mean it. All this shit's gonna stop. These people fuck with the wrong person's kid. I've always been an advocate behind the scene and made plenty of changes in every fucking arena. All right, healthcare, employment, and otherwise. And it's always the universal response from all these motherfuckers. That's bad apples. Okay, not the overarching entity, but the employees that they have in place and the shit that they're doing and what these people do. They're the offshore culprits. These are the people, these are the demons and the devils and stuff like that that's in there, the dark arts that's causing the complications. They must be weeded out. So the overarching entities and authority over those entities itself, okay, accrediting bodies, right? Licensure, right? Lawmakers, legislature, taxpayers, any and everybody that has an interest in the public policy and the public interest and things like that, that are fundamental in issues and underlying right here. Okay. So healthcare, that's the fundamental basis that this is stemming off of, right? I always talk about alternate things. Employment, that's the underlying issue stemming out of some other shit that I've already told people about. Okay. Housing. All right. So when you talk about landlord, tenant, slumlord type bullshit that I've talked about on this YouTube stuff and other videos and put it on Twitter, TikTok, everywhere else. So housing, you got plenty of examples of the wrongdoing and the bullshit with the housing. With the housing, you got a Judge Karen Phipps in Columbus, Ohio, in 22 CB 3620 for the Court of Common Pleas. That's a whole deprivation of rights right there. It's very complex as well. All right, all right. And I had to be pro se in that particular matter. Okay, I'm not no fucking attorney, but I'm telling you, most people don't have the wherewithal. They don't have the knowledge and shit like that to even battle up against these types of shits. Okay, but what it is, the people that keep doing this stuff, they think you're a dummy. They think you're fucking stupid and shit like that. Okay, so educate yourself. This is a tip for you out here. Educate yourself any way that you can. Seek the information. Teach yourself things. If you have an opportunity to go out here in any capacity, educational or occupational, and gain awareness and knowledge in a lot of different diverse areas and arenas, please do that, because it will create you as an individual, all right, to be a warrior, all right, for yourself, self-advocacy. And hopefully at some point, you'll be so good at it to where you're able to pay it forward to others, all right? So you go and you show that you're not going to take it, and you're not going to allow anybody else to have to take it, or you're going to pay it forward, all right? And you're going to stand at the forefront. You yourself you're going to be a change agent as well, all right? Because that's exactly what I am. I'm a whole fucking change agent, all right? All right, and I'm on a whole mission now because I stayed behind the scenes for so long, in so many years, and I just asked these people to leave a bitch alone. They didn't want to. They wanted to keep. why you do that, boo-boo? But now it's too late. It's too late. You know you done fucked up, right? You know you done fucked up, right? It's too late. There ain't no coming back from it now. It's over, wrongdoer. Your time is up. All right, so we'll come back because hopefully the Ohio Department of Health or CMS or somebody will get in the comments and they'll say, guess what? Ta-da! Catherine Reamer, maybe? Carly Tennant from the Adam Board, maybe? Yeah, Catherine Reamer from Mental Health of Ohio. Or maybe somebody from Disability Rights of Ohio, like excuse me, Nellie Pratt, Keisha Tans. Remember the one abuse I told you about on April the 14th of 2022 that happened at OSU Harding Hospital and shit like that? Maybe they'll come in and tell their sides. Maybe they'll come in and say, that ain't what we did. You know you lying. This is what we really did. Oh, maybe Wendy Williams, Chief Operating Officer. No, that's not true. I never sent an email with somebody's first and last name, and I didn't say they had anxiety, and I didn't give them email and everything, and say that they need to go to the pantry, and that they was discharged from Genesis, and give you that information, everything about the patient in the whole header line that said forward FW colon patient first name, patient last name, and when you click on the body, it had everything. I didn't do that. Why is she fucking fired? See, that's why motherfuckers be trying to fire me, y'all. Motherfuckers like to fire me and shit like that. That's what the dumb shit that they be doing. It's not me, it's them. All right. But they be like, we ain't admitting no wrong. So allegedly, allegedly it's them, right? I've let a lot of wrongdoers off. I let a lot of wrongdoing motherfuckers slide and shit like that. I really have. A lot of employers, I let them slide. A lot of entities I've let slide. Yeah, I have. So it's okay. I can come out here and give the awareness now because I just want you to be safe. I let a lot of people slide. I told you about SEIU 1199 as well. I worked at the Department of Rehab and Corrections at CRC. And it was just a whole bunch of mess. Everything's in grievance there from August of 2010 to January of 2016. They can pull every single grievance that I've ever written. There's a lot of wrongdoings in that particular place. And they just kept being called in the carpet time after time after time. And any fucking thing that they tried to do, all these tactics and shit like that, they were trying retaliatory tactics and efforts, because when you start to bring the awareness on the outside of what's really going on, that is what universally will happen. You're going to be retaliated against. Everybody does it. When I tell you about the housing shit, when I tell you about employment shit, when I tell you about this healthcare shit, when you put people on task with what they really are supposed to be doing, what they say that they're doing, and in their missions and their vision statements and all this type of shit, or whatever their obligations are under the law, under their own, professional conduct and ethical types of conduct, rules and regulations and licensing board type shit, whatever their oversight is saying it's supposed to do, and whatever. When you put them on task, and hey, you're not doing this, you're not doing, that ain't right. I'm not going to do this. And hey, don't ask me to do that because that's against the law. You don't ask me to do that. That puts a patient at risk. No, I'm not doing that. That's a lie. That's a lie, right? Why would I do that? So you can meet a metric or something like that. Why would I do that? You don't never delete nothing out of a patient's record or something like that. Why, bitch, why you fucking ask me to do that shit? There was a whole person at Landmark Health that asked me to do that. Yeah, she literally did. Asked me to delete something out of a patient's fucking medical record. Yes, she did. Her name's Anne Marie Martin. She's currently like some type of health service manager at Landmark Health in Hilliard, Ohio. She did that. It's true. And it's also in their compliance report. I turned them in. I turned her ass in. And I also told her some other quality management nurse, her name was Natalie, what the girl did. They know these people don't do anything. She sent it in a Skype message. That's why I told you, people out here in the real world, utilize the snippet tool and shit like that. And you need to copy paste stuff into different documents where it will magically disappear, because that's what these bad Apple people do. They utilize different mechanisms in which you will never be able to have it as evidence and recover it, because it's gonna disappear, like Skype, even the Teams chats and stuff like that. You need to use snippet tool. When you see people talking that bullshit and doing subtle discriminatory stuff and and laughing and joking about it, you can snip it out. Take that snippet snippet that shit out, name it something, right click, copy, paste, or whatever, your control C, control V, name it something right there. All right. Name it something to where some things and some depending on where you work, some things if it has different case numbers or somebody's social security number, something like that, you're not going to be able to get it out to email it to yourself. So that's when you need to still snippet it. You can put it in like a folder on their document, on their shit, or whatever, name it something that nobody can really tell. Then if you know that you're getting ready to sue their ass or something like that, what you really need to do, you need to put, if it's encrypted, you couldn't send it to yourself. Anything else, you need to copy it and put it on a Word document, name it, and send it to yourself. All right, or what they're doing. So you have your own documentation and your evidence. Anything that's encrypted and you're not able to do like that, then you need to make sure you have your own separate note. Always keep a journal of everything that you're doing from the first day that you went from the job, from the first day that you enter into anything with anybody, because motherfuckers at the top of your mind, instead of thinking that motherfuckers got your back and they got your best interest at heart, it's the other way around. I've learned that. So you need to take love. Anytime you meet somebody, like, hey, how you doing? Be respectful, be professional, stuff like that. But always keep it under your cap and in the back of your mind, like, this motherfucker fake. They don't give a fuck about me. They only want to use me. It's something that I have that they want, and they're trying to meet their own agenda in their own best interests. Okay, at the detriment of me, so that they can exceed me, do better, and then kick me to the motherfucking curb and over the motherfucking cliff to drown and die. You keep that at the forefront of your mind until a motherfucker show you different. All right. And even with that, even when you start to think that they're showing you different, they doing little things for you and stuff like that, be very cautious with that too. Because what people do, they do shit like that. Okay? Do little things for you. And because if they're tricking you, they want you to believe that you can trust them. That's what people do. They do little small things that makes you believe that they care and that you can trust them. You can tell them anything. You can show them the tools and tips to educate you because they're reeling you in, right? To do what? To trust them. They reel you in to trust them. It's a deceptive game. And you better get hit to it right now and stop it because they're trying to destroy you. It's true. Period. Something happened to me times to me now that I'm just like, okay, I won't take it. That's why I stay to myself. I stay in the house and I just be cold, chilling. And that's why, I don't ever understand why motherfuckers keep fucking with me because I don't bother nobody. I don't do shit. I just be cold, chilling. I just ask that you do the right thing for the right reason, at the very basic level. And that's it. Stop violating the law. Stop doing unethical shit. Stop going against what you fucking know you're not supposed to be doing. Like in this particular instance, it's obvious River Vista is going against the standards of care, clinical practice, best practices, that anything is being outlined and stated in research that equates to the optimization of patient care. Same thing with Southeast Mental Health. They're all doing that type of shit. I talked to you about Karen Phipps, that judge. She's a rogue in a black robe. Somebody wrote a book. It's called A Rogue in a Black Robe. I don't know what their name is, but anyways, they did. And those people like that, they actually do exist. You don't ever deprive somebody of their rights. Yeah, she actually revoked the right to litigate a particular matter that she actually knew had never been litigated, but she took part of the story behind, where some layperson was like, oh, they litigated that matter already because there was an agreement that was signed in that. She stopped at that point, but she didn't tell the full story behind the agreement that was signed, that there was really duress involved. And she didn't go into details about everything else that was involved in the complexity of the matter, right? She didn't talk about the code violations that these people ignored. She didn't talk about the retaliation case that the city attorney of Columbus, Ohio, Tierra Ross had. She didn't talk about the environmental case that the city had against these people, right? And were defendants into CB 3620. She didn't talk about that, how City of Columbus, Chris Clark had to actually bring a case post the tenant exercise of right to complain to a government agency about condition dwellings where there actually does exist in real life over 29 public records for 311.gov in the city of Columbus, Ohio, which are not only complaints, but also outcries for help and notification of the severe retaliation that was taking place, right? It's all there. And the city of Columbus has no intention whatsoever in ever enforcing anything. They just do things to make it look good on paper for the public, because you put a complaint in on a public platform, it's a public record. They have to show and illustrate that they answered that in some type of form. Mhm. So that's what they do. They just play and they just fake. There was so at this time, let's see, there was a case. If you want to look it up, Franklin County Municipal Court 21 CV 020 711. That's a case. That's a retaliatory eviction case that actually had to. It was closed when an agreement was signed, but the agreement was signed under duress because Michael Casone, he's a bad apple attorney, placed the tenants under duress. He actually sent them a threatening letter telling them that if they did not go and retract the true report of fraud that his client, Krishna Quadatata, actually was participating in by submitting what? False insurance claims to Amazon Home Insurance and or Liberty Mutual Home Insurance with dates that were not correct, because his client, Krishna Quadatata, knew all along all the pre-existing conditions and his piece of shit, she shared shackle bullshit. Okay, that was unsafe, inhabitable, putting the lives of motherfuckers that lived there at risk. He had a whole water heater with rolling flames on and shit like that with Columbia Gas. Had to come shut the fucking gas off. Okay, it was a whole autistic child in there and shit like that. The city of Columbus got the nerve audacity to be posting shit like they give a fuck about kids and kids safety and shit like that. Now that they talk about gun control, bitch, they don't care nothing about no kids. There was a whole autistic kid in there and shit like that. People was in there getting ready to lose their life, getting ready to blow the fuck up. Okay, you think they care? Not even. They had documentation of it. They don't give a fuck. And they don't care nothing about Michael Casone and the bullshit that he did. Okay, all right. So you can go look up the case and you can go on Twitter. It's all on there. It's all true. Nobody will ever come and rebut, refute a damn thing. It's all true, and there's evidence and there's receipts. Okay. Yeah, so that's the key. Always keep your evidence. Always have your receipts. Always document. I told you, use a snippet tool. All right, so that's a tip for you. These people out here that are wrongdoers, what they do, they use mechanisms in which it makes it very difficult for you to save or have, and that could ultimately equate to something being discoverable in a legal claim. So your Skypes and your Teams meetings and stuff like that, or your one-on-one meetings, you absolutely need to be documenting very, very well and quoting anything that people are saying or doing. Number one, if you can't capture it electronically, from the day that you report or day you enter into anything with anybody, I don't care if you think they're the nicest motherfuckers, or I don't care if ain't shit even happen. Something's going to happen. Use document. Period. Everything, everybody's name, everything, what they got on, if they was looking cross-eyed, okay, missing a fucking tooth, shit like that, all that, wearing something raggedy and shit like that, with the dookie pea stain on it that they had got down there at the free fucking store in Parsons, that where Southeast Mental Health always tries to take their vulnerable mental health people and acting like it's a resource and stuff like that, getting them candles and shit like that's already been burnt down and the wicks having this stuff. You want some smell goods in your house? You can get that candle. Okay, does your child want a toy? And it's like a little big wheel and it's missing the wheels and shit like that. It's okay, just use one leg over here and just your kid can just use one leg and roll it like that and it's okay. Little shit like that. Anyway, we'll be back with more. Get in the comments, ask some questions, share some of your stories of some wrongdoings or something like that. And we'll help you out with these 2 tips of education for free. Now you can have a free consultation, but at some point, if we get into the complexity of these things, and which we hope to do one day as a part of our community agency that we're trying to really put together, we think about turning it into a nonprofit so that you don't really have to pay, because it's going to be all encompassing. It's going to have the food pantry. It's going to have the clothing pantry. You're going to be able to get personal hygiene items and stuff like that. You're going to be able to get education and resources. You can sit and talk to somebody if you want to. Yeah. We'll have real counseling sessions and shit like that. Or you can just, somebody just sit there and listen to what you got to say and all this type of stuff. We're going to do assessments. All right. If you don't want no damn pig ears and chitlins and buttholes and hot dogs, then you don't have to eat that just because you're going through a hard time. You're homeless and stuff like that. We're not going to give you no damn canned goods to carry around 500 million pounds in your book bag and shit like that on your back while you're out here homeless. These people don't make you sick yet. You ain't seen nothing yet. Thank you for tuning in on Breaking News Update. We'll be back. Everybody should be shaking in the boots. All you wrongdoers, you should be shaking in your boots. I'm gonna tell on you. Yes, I am. And I'm gonna tell your name. Thank you, Jesus. Boop. Okay, I'm gonna have me a cigarette. A cigarette.